Hello everyone, my name is Bumi Okoya. I'm the interim lead nurse for practice education within NHS Grampian. As part of the changes that are occurring within the organization or nationally, actually, it's around the Future Nurse and Midwife program. If you've been following us, following the practice education team on Twitter, on Facebook, you would have been seeing different tweets around this. We've got the transition route and we've got the preparation route. Currently, if you're a mentor on the mentor register, all you need to do is to undertake the transition route. If you go on to TURAS, under Nursing and Midwifery Education Passport, click on that and that takes you to a link which is titled Future Nurse and Midwife Program. You will not miss it. The second route is the preparation route. So if you've never been on the mentor register, if you've never been a mentor before, all you need to do is to undertake the preparation option. That is coming to TURAS soon. So if you have any question around that, please feel free to discuss with your practice education team. Now, if you've previously been on the mentor register, but no longer, you've not mentored somebody for such a long time, but you were previously on the mentor register, that's a discussion you need to have with your manager and your practice education team to discuss which route will be most suitable for you.
Practice supervisors will supervise students learning in practice and working towards achievement of the programme learning outcomes and proficiencies. The named practice supervisor will also be a main source of support for students along with a practice assessor and other staff.
Under previous NMC regulations, student nurses had to spend 40% of their time on placement working alongside their mentor. That no longer applies, and student nurses can be supervised and supported by a wide array of members of staff.
One of the most notable changes for practitioners following the introduction of the new standards for student support and supervision is the removal of the terms mentor, sign-off mentor and practice teachers. These roles will no longer exist, and instead all work will be carried out by either practice supervisors or practice assessors. With this in mind, all students, including those at their final stage, will have their assessment completed by the practice assessor, who gathers feedback from all practice supervisors. The practice assessor will then work in partnership with the academic assessor to evaluate and recommend the student for progression for each part of their programme in line with local and national policy.
Placements in a variety of practice learning environments is very important. These may be in a primary or secondary care setting. Primary care includes community teams such as health visiting, district nursing, or services providing care in the community or home, such as social care or in some cases charitable organisations. Secondary care includes hospitals such as Aberdeen Royal Infirmary, Dr Gray's, or any of the community hospitals across NHS Grampian.
The standards of proficiency for midwives specify the knowledge, skills and understanding midwives must demonstrate at the point of qualification, whilst caring for women in their maternity journey in all care settings. The new midwifery standards won't be embedded in the undergraduate midwifery curriculum until September 2021. However, the document is live, so please have a read and familiarise yourself with it. Midwives will, however, move to the new standards for student supervision and assessment in September this year. So it's important that all staff undertake either the preparation or the transition package as soon as possible.
From me and from the practice education team as a whole, thank you.